Good morning, everybody. Welcome to today's webinar on the new Robert Wood Johnson Foundation newly released call for proposals on supplemental COVID-19 studies related to systems alignment from as part of the RWJF's Systems for Action research program. Thank you for joining us today. Let me just do a quick sound check and make sure I'm coming through okay for our program staff. You guys hearing me loud and clear? Yes, fantastic. Thank you. Always good to check in today's webinar world that we're all living in. My name is Glen Mays. I'm a professor and chair of the Department of Health Systems Management and Policy here at the University of Colorado School of Public Health. And I also have the pleasure of serving as director of the Robert Wood Johnson Foundation Systems for Action Program, National Program Office. And Systems for Action Program, which we'll talk a little bit more about today, is one of the signature research programs at the Robert Wood Johnson Foundation and is the sponsor of this particular call for proposals released last week that we'll be giving an overview of today. So just in terms of our agenda for today, we're going to give a brief overview of the RWJF Systems for Action research program, what it's about, what it's done so far, and then go right into a discussion of the overview of the call for proposals for COVID-19 related research that was released last week on July 1st. We'll talk about the major components of that call, eligibility, what kind of studies are relevant for this particular call. We'll talk a bit about the mechanics of submitting a proposal and some of the key dates and deadlines, and then how to apply. We'll make sure to have ample time later in today's session for questions and answers from those of you on the webinar with us today. Let me just do a little bit of housekeeping, and then I'll get into some further introductions. We are recording today's session, and the recording, a link to the recording and the slides will be emailed to those of you who have registered for today's webinar. They'll also be posted on the Systems for Action website, just systemsforaction.org. We do have a pretty large group with us online for today's webinar, and so for that reason, to manage the process, everybody is muted. All of you who have joined with us on the online portion of this webinar, or if you've dialed in for the dial-in version, you are muted. So you're not going to be able to vocalize during today's call, just given the large number of people we have online. We encourage you to submit any questions you have during today's webinar using the Q&A box, which is a tab. You should see a Q&A icon at the bottom center of your screen. You can click on that icon, and that will allow you to submit, to type in your questions. We'll get to as many of those as we can during today's webinar. If we don't get to them all today, we will post, subsequent to this webinar, we will post short answers to those questions, again, on our website to make sure we get to those questions today. So just a little bit on housekeeping. Let me next move on to a little bit more introductions, some key people you need to know, starting with our leaders at the Robert Wood Johnson Foundation. Carolyn Miller is Senior Program Officer in the Research Evaluation and Learning Division at the Robert Wood Johnson Foundation, and she is one of the key leaders of the Systems for Action research program, along with her colleague, Dr. Octavia Wojcik, who is also a program officer in the Research Evaluation and Learning Division of RWJF. And so these are our principal leaders at the Foundation for the Systems for Action program and for this particular call for proposals on COVID-related research. With that, I'd like to pause and see if Carolyn would like to give some opening remarks for today's webinar.
Hi, thank you, Glenn. Can you hear me?
Absolutely.
Okay, great. Good morning, everyone, or afternoon, everyone. Thank you so much for joining us. On behalf of Octavia and myself and the Foundation, I just want to welcome you to this webinar and thank you so much for your interest in learning more about this new call. I'd also like to thank our Colorado team for being able to move this call along fairly quickly. You'll see that this is a different kind of call for the Systems for Action team. And for us, we are trying to see if we can provide some support to take advantage and to leverage some opportunity to learn more about some system alignment mechanisms that maybe we already know something about or are in place, but we could possibly learn more about how they are reacting and acting in this environment of COVID. So we're very excited to be able to move this new grant, this new CFP forward. It's a little bit different, as I said, and Glenn and team will take us through the CFP and explain the ways in which it's different. It's a little bit different from other Systems for Action calls that we've had before, but we're very excited that there's such a large interest in this, and we're excited to be able to move this work forward to try and leverage try and get some opportunities and leverage some opportunities out of our current environment. So on behalf of Octavia and myself, thank you again for joining us, and I'm going to turn it back to Glenn. Thanks, Glenn.
Fantastic. Thank you, Carolyn. And again, thank you to the Robert Johnson Foundation for their support of this program and this new call for proposals. The National Program Office for the Systems for Action Research Program is based at the Colorado School of Public Health, where I'm coming to you from. As I mentioned, I have the privilege of serving as director of the program office for this program, and I also have the good fortune of working with a very talented group of colleagues based in Colorado who provide core staff for our national program office, including Chris Lytle, who serves as deputy director of the Systems for Action National Program Office, those of you interested in the CFP and responding to it will no doubt be hearing from Chris at multiple points along the way. Other key members of our team relevant for this CFP include Sarah Brandspiegel, who directs our research engagement and translation activities for the Systems for Action program. We are a for-action research program, and we take that action word very seriously, and Sarah plays key roles in helping us figure out how to move research findings into action across the health system. Also, Carrington Lott, who's a program manager with us and really a jack of all trades and helping to support operations of the program. And then Sadina Belmashkin, who is our communications coordinator, also has her hands in many aspects of our Systems for Action program. And so these are voices, if not faces, that you will encounter as you engage with the program in this CFP, as well as other activities of the program. So with that, let me step in and give a little bit more background about the Systems for Action program. This is a program that was launched by the Robert Wood Johnson Foundation almost 5 years ago, back in the middle of 2015, really as a research program. It's one of the signature research programs of the foundation, designed to generate evidence to help us learn about how to build a culture of health to promote health equity across the U.S. And in particular for the Systems for Action program, we obviously focus research on systems, and specifically testing ways of aligning medical care, public health, and social service systems, the systems in all three of those sectors, to improve population health and advance health equity. That is the focus of Systems for Action, and also really kind of distinguishes how Systems for Action is a bit different from some of the other signature research programs of the foundation, like the Evidence for Action program that you may be familiar with, the Policies for Action program, the Data for Action program, for example. Systems for Action is unique and really focusing squarely on the topic of systems alignment, testing novel ways of aligning medical, social, and public health systems, delivery systems, as well as financing systems in ways that can reduce fragmentation, improve service delivery, improve the collective capacity of communities to meet the health and social needs of their residents in ways that can improve health and importantly, improve health equity across the country. We do have a research agenda that guides much of the work of the Systems for Action program. Encourage all of you who are interested in the CFP to, if you haven't already, to download that research agenda, take a careful look at it. It describes in more details the kinds of issues, the types of system alignment mechanisms that we're particularly interested in building evidence around, learning which ones work in what kind of community circumstances for what kinds of population groups. And you can find that research agenda on the Systems for Action website that's shown here at the bottom of this slide. You can also find descriptions of other studies that we funded previously through previous rounds of Systems for Action calls for proposals. We're up to almost 30 different studies that have been funded through the S4A program over time. And would encourage everyone to get on the website, get familiar with some of those other studies so you kind of understand how your idea might fit into the larger constellation of research that's being supported around learning what kind of system alignment mechanisms work across the country. Okay, so let's talk a little bit more specifically about this particular call for proposals that was just released on July 1st last month. A couple of things to note. This is positioned as a supplemental research opportunity. And so what we're looking to do with this particular opportunity is to support existing studies that are testing ways of aligning medical, social, and public health systems, providing those research teams with some supplemental funding to continue and extend their studies into the COVID-19 era so that we can learn how well those system alignment strategies that are already being studied, how well they work in this new environment of COVID response and recovery. And in particular, how well these system alignment study mechanisms work in helping populations address the social, economic, and health disruptions associated with COVID-19. So this is designed as a supplemental research award. We're looking to fund existing or recently completed studies of system alignment mechanisms, giving those studies some additional funding to extend their work into the COVID-19 era so we can learn how well those system alignment strategies work in this new environment for the populations that are disproportionately affected by the health, economic, and social disruptions associated with COVID. So supplemental research. If you've got an idea for a new study, something that you haven't studied before, a new system alignment mechanism, this particular opportunity is probably not appropriate for you if you've got a new idea for a new study. We are going to have, as we have done every year, we will be later this year releasing a new CFP that's really better targeted for new studies of new system alignment strategies. So think carefully about that. If you've got an existing study and you can extend it with this supplemental funding, this is the CFP that's really designed for you. If you've got a great idea for how to align health and social systems, but you haven't studied that mechanism yet, you don't have an existing or recently completed study to kind of extend and piggyback on, then this supplemental research CFP probably not the best for you. We'd encourage you to wait a little bit longer. Later in the fall, we will be releasing our open call for new research on system alignment. And in fact, that open call will have awards that are larger and a bit longer term than the awards that we're offering through this supplemental research CFP. So that's a really important thing to keep in mind with this call. It's designed to be supplemental. We're trying to add some funds to existing or recently completed studies to extend those studies in through the COVID era. Through this call, we can offer grants of either 12 months or 20-month, 4-month periods. So 1 to 2 year awards of up to $100,000 per year in total funding. And so these are relatively compact studies. And again, because we're leveraging, we're adding funds to some existing studies or recently completed studies that already have some data, some metrics that they can build on, already have a research design that has been in place that now hopefully they can extend for some additional periods into the COVID response and recovery periods, extending for 12 or 24 months with these awards. So that's important to keep in mind. This is supplemental research, limited in scope, really trying to target existing or recently completed studies. Let me see if I can let's see if I can share my screen here, and it looks like I can't share. Let me ask Sedina if you can you pull up the link to the landing page for the RWJF website? Awesome. Exactly what I wanted to do. So what you're looking at now is the link to the CFP announcement on the RWJF website. I want to point out just a few key things on this website. First of all, you want to go to this website. There's a brief description of the CFP award opportunity here. There are also some links to some key materials that are very, very important for you to review before you click that green button and decide to submit an application. Under key materials, you see there is a link to preview a sample of the proposal process before submitting, and you can click on that and get a sense of all of the elements you'll need to provide, complete, and upload as part of the application process. And that's particularly for those of you who have not applied to an RWJF grant in the recent past, be important for you to click on that link to preview that application. This just shows you what the screens will look like when you do click that green button and officially start your application process. Forms, fields to fill out for key key individuals, and places to upload your budget template, your budget narrative, your actual proposal narrative, to upload other key materials that you'll need there. So definitely click on that link, download this sample proposal, and you'll get a sense of all the things you're ultimately going to need to put together and upload into the online proposal submission website of RWJF before that deadline of August 5th. So next, below that, some other items under that key materials we want you to pay careful attention to. Next is the actual full funding opportunity. And so if you could open that up, Sedina, we'll spend a little bit of time on that. This is a PDF document, 10-page PDF document. This describes this particular CFP funding opportunity in much more detail than you will see on that landing page of the website. So really encourage people to download this 10-pager, read it carefully, because it will tell you in greater detail what kinds of projects we're looking to support with this particular call, and key elements you want to make sure to include in your proposal submission. And as we scroll down here, a few things to keep in mind. Again, this is a focus on this first section here, system alignment mechanisms. Very important. It's a research program, and so we're looking to fund studies of specific system alignment mechanisms for aligning medical, social, and public health systems. And so you want to take a careful look at how we define system alignment mechanisms in the CFP. Of very much importance for you to submit a responsive proposal to this call. You need to be proposing to study a system alignment mechanism that engages all three of those sectors that I've mentioned several times already: medical care, public health, and social services. You have to be studying a system alignment mechanism that engages in attempts to align activities in all three of those sectors. So you will see, we define those sectors in greater detail further down in the CFP. We encourage you to take a careful look at how we define medical care sector, public health sector, and the social services sector for the purposes of this CFP, because again, to submit a responsive proposal to this call, you'll need to incorporate those definitions of sectors and system alignment, and make sure that your proposal is consistent with those definitions of the three sectors and the notions of a system alignment mechanism that engages all three of those sectors. So we can scroll down a bit further here in the CFP document. This next section describes alignment with RWDF vision and strategy here. Again, the system alignment, the Systems for Action program was designed to build evidence for the Foundation's culture of health, vision, and action framework. And so you also want to be familiar with that action framework, and you can think about how your study idea could contribute evidence toward that larger framework. There's a description of the program activities under the CFP, which, as I mentioned, either supplemental awards, can be 1 year or 2 years in duration, and can receive up to $100,000 per year in total funding to support the project. So the maximum award that would be issued with this call would be for a 24-month or 2-year project. It would receive a total of $200,000, up to $200,000 in total funds to support the proposed supplemental research. This is a research program, and so we do place heavy emphasis on scientifically rigorous research methods that can produce evidence about the implementation and the impact of the system alignment mechanism being studied. And so we're looking for rigorous approaches to research design, analytic methodology, data sources and measures that are used to measure the implementation and the impact of the system alignment strategy that's under study, particularly in the context of COVID-19 and populations that are disproportionately affected by COVID-19. And so I want to keep that in mind, that research rigor of the research design and methodology is given pretty heavy weight in the CFP, as in virtually all of the funding mechanisms that comes out of our Systems for Action program, because we are a research program that's primary mission is to produce evidence about how to align systems. We also are a for action program, and so as mentioned here, we also place a heavy emphasis on positioning research findings to be moved into action to actually have a real world impact. And so that means engaging stakeholders in the research process, stakeholders who potentially are positioned to use the evidence that is proposed to be produced by the proposed study. And so we're looking for, in addition to looking for strong research methodology and design, we're looking for strong mechanisms for stakeholder engagement as well being proposed here. A clear understanding of who the stakeholders are for your study, who is positioned to actually use the evidence from your study to align medical, social, and public health systems. We are, as with all RWDF programs and grant making, operating in a place heavy emphasis on open access to research findings and data. And so we certainly expect grantees that are funded under this initiative to broadly disseminate the research findings, certainly publish their findings in peer-reviewed publications, as well as using other ways of dissemination. But importantly, for peer-reviewed publications, grantees must publish those publications in an open access format that ensures broad access to the findings, not restricted by a paywall of a proprietary journal. And so you need to budget for that in your budget in terms of being able to make sure that your peer-reviewed publications can be published in an open access format. Okay, a few elements on eligibility criteria. For this particular CFP, applicants must be either public entities, governmental entities, or nonprofit organizations that are tax exempt under the 501c3 code of IRS. And there may be additional documentation required for selected applicants based on your status, either as a government agency or a tax exempt organization. You must be based in the U.S. or its territories to be the primary applicant for this CFP. Okay. So there are other details on the CFP that I encourage folks again to read carefully. There are, if we scroll down a little bit more, this statement about equity, diversity, and inclusion, very important, particularly for the type of evidence that we're trying to produce here around system alignment in the context of COVID-19 and populations disproportionately affected. We are committed to fostering diversity and inclusion in the organizations and the individuals that are funded to conduct research under this CFP. So we particularly encourage applications from diverse organizations and individuals that are new to the foundation. This opportunity is not at all limited to entities who have been funded previously by the Robert Wood Johnson Foundation or entities that have been funded previously through the Systems for Action Research Program. That is not at all a restriction here. We are very interested in funding organizations and individuals who are new to the foundation, new to the Systems for Action program. As long as you have, for this CFP, an existing or recently completed study of a system alignment mechanism that would be relevant for the topic here. Next, you'll see down at the bottom of page 5 onto page 6, the selection criteria for this particular CFP process. I encourage you to read through these carefully. These selection criteria are somewhat different from criteria we've used in past CFPs, given the nature of the topic here and the fact that we're putting heavy weight on funding projects that have some existing studies underway of system alignment mechanisms that they can build upon and extend into the COVID environment. We, as with all of our the research that we support through Systems for Action, we place a heavy emphasis on research that can produce findings that are relevant to improving health equity across populations. In this case, populations that are disproportionately affected by COVID-19. And so the ability to test and measure impact of the system alignment mechanism under study, particularly measuring impact on health equity in the context of COVID, will be very important, as well as the potential to take the resulting evidence from the proposed research and move it into action, disseminate it to stakeholders who can use that evidence and support those stakeholders in applying that evidence in the real world for system alignment. So those 5 selection criteria, I encourage you to take a careful look at those as you're formulating your ideas and developing your proposals. There are other important elements on the CFP that I don't have time to go into in great detail, but again, encourage you, it's only 10 pages, read through carefully several times, encourage you to do that. And there's also more detailed instructions on how to apply when you're ready to submit your application. So if we could toggle back to that main landing page for the RWGF, I'll just point out a few other things. There are 2 different links for frequently asked questions or FAQs. We encourage you to look carefully at. The first batch of frequently asked questions are kind of generic FAQs for that are foundation-wide FAQs for anyone who's applying for a grant from the foundation. You should look at those carefully, particularly if this is your first time submitting an application to RWJF, or if you haven't done it in a few years, because things tend to change in terms of processes a bit. And so take a close look at the FAQs there. just below that. Oh, good. Yeah, so these are the general FAQs that you'll see. General questions about eligibility, about the review process, about the submission process, the timing, those kinds of things you can find on these generic FAQs. And then down just below that, you'll see program-specific FAQs. These are also very important. I encourage you to take a close look at these because these are FAQs specifically geared toward our Systems for Action program and for this particular CFP around COVID-19 studies. And so one thing to make note of, again, this CFP is designed to support studies of an existing system alignment mechanism that has already been studied to some extent through past or ongoing research that you may have underway. We do have language in the CFP that allows you for adaptations to be made to those system alignment mechanisms, particularly adaptations that may have been made in the context of COVID-19 to make the alignment mechanism more responsive to needs and disruptions associated with COVID-19. And so, so we've got some language in here about what's considered an adaptation of the system alignment mechanism and what are we looking for there, versus what would be considered a new system alignment mechanism that hasn't been studied to date. And so I encourage you to take a look at these FAQs in particular. We've got our definition of health equity, what we mean by that, what we're looking for in terms of measuring impact on health equity. We've got questions about how these three sectors are defined, how we define system alignment mechanisms in the context of this CFP, how we define systems in terms of delivery systems or financing systems. All of those details you'll find more information in the FAQ, program-specific FAQs for this call. So please take a look at that. Okay. Last thing that I'll mention here, and then we'll go to some questions. The letter of intent. We are asking for those of you who are planning to submit proposals to the CFP to send us a brief letter of intent indicating to us that you intend to apply and giving us some minimal information about the topic of your intended proposal. This is not a requirement. You don't have to send us an LOI. You can just proceed ahead and submit an application. But so it's non-required, it's non-binding, and it will not affect how your proposal is ultimately reviewed. It's just information for us as a program office that helps us with planning, anticipating how many proposals we're likely to get, and give us something about the range of topics that will be covered so that we can make sure we've got the relevant range of expertise represented on our review panel to fully review and understand your proposal. So not required, but it's in your best interest to send us an LOI so we can anticipate your proposal and we can make sure we got the right expertise on our review panel to be able to give your application the fullest possible consideration. So we ask you to submit those LOIs by July 20th at 3 p.m. Using the link that is here. You're actually seeing here. If you click on that LOI link from the main landing page, you will get this screen and you can click on that blue button and it will step you through a brief process of submitting your letter of intent. Not required, but it's advised, and we ask you to do that to give us information to help us have the strongest and fairest possible review process for these CFPs. Okay, so why don't we toggle back to the slides, and then I'm just going to go one more slide. It's one more slide here. I think and we've gone through the eligibility requirements that are detailed in the CFP, and then we've been through this letter of intent process, but we're asking for you to submit by July 20th. The full proposal is due by August 5th, by 3 p.m. Eastern time on August 5th. And so I know that's coming up. That's about a month from now. It's not a lot of time to pull this research together. That's another reason why this particular CFP is designed really for research teams who've got an existing study to build upon. So hopefully it's not a huge, heavy lift to kind of pull proposals together for this CFP. And I would say, that deadline comes up soon, and we do tend to have a lot of traffic, a lot of people submitting applications right close to that deadline. So we encourage you, to the extent possible, to start working on your proposal submission prior to that deadline of August 5th, because as we get really close to that deadline of 3 p.m., our capacity to respond to questions and problems you may encounter becomes very limited in that last couple of hours. And so just keep that in mind. We may not be able to return phone calls and address emails on that last day. So please keep that in mind. Proposals that are submitted, we use a robust review process that includes members, the reviewers include members of our National Program Office based here in Colorado. It includes members of our National Advisory Committee, a very talented, multidisciplinary, diverse group of people. You can see their names and backgrounds listed on our website and at the back of the CFP, as well as reviewers from the Robert Wood Johnson Foundation. And we expect to be able to make funding selections and notify applicants of funding decisions in September as a part of this process. Okay, so I think the next slide has got a few key dates. Just as reminders, those are the key dates. August 5th, 3 p.m. is the deadline for submission. Notify finalists by September 15, and the grants will start, we anticipate grants will start on or about November 1st of 2020, either 1 year or 2 year awards. Okay, so with that, we are going to open it up to questions and answers. And I'm going to see, Chris, do you want to help me with these Q&As? Do you want to read some off? And we'll try to answer them.
Sure, I can do that. And folks can continue to add questions to the Q&A. I've got a pretty healthy list over here. Give me 1 second. Okay. So
you can go right ahead.
To be eligible for the CFP, can an ongoing study be funded by a different source than RWJF? And do they have to be S4A?
Yes, as I mentioned earlier, you do not need to be, the existing study does not need to be funded by RWJF or funded by the System for Action program. We are wide open in terms of the funding support for the existing or recently completed study that you're building upon. It does not at all need to be a previous RWJF funded study.
Thanks. And a lot of folks have made mention or have referenced our research agenda. The link on the funding opportunity page needs to be updated, and we will do so. But we do have a question about our preference of quantitative studies or qualitative studies.
Yeah, we are open and agnostic in terms of research methodologies. The best methodology is the one that's designed to answer the questions that you're trying to answer. That being said, as mentioned in the CFP, we are looking to support supplemental studies that can produce new evidence about implementation and impact of the system alignment mechanism under study. And so whatever combination of research designs, methods, and data that you can pull together that you think best positions your study to produce that evidence about implementation and impact in the context of COVID-19, that's what we want to see. Awesome.
And we know that the content of the CFP is pretty expansive. So some folks are asking if you could provide some sample research questions that would fit under this funding opportunity.
Yeah, we have not identified sample research questions here, again, in part because the nature of the CFP is targeted toward it's a supplemental research to add on to existing studies or recently completed studies. And so presumably the kinds of research questions you can answer are going to be contingent on the type of study you're building upon, what existing data, what existing research design methods and methodology that you're building upon. And so we really are looking to you as applicants and as a research team that has an existing study of an existing supplemental mechanism to tell us what research questions you can answer, building on that foundation that you've already built. And you'll see in the broad type of evidence we're trying to build, I think, are spelled out right in the CFP. We're looking for studies that can tell us about, for a specific system alignment mechanism, tell us something important about the implementation and the impact of that mechanism in the context of COVID-19 and for populations disproportionately affected by COVID-19 and its social, health, and economic disruptions. So broad brush, that's the kind of evidence we're trying to produce. The specific research questions that you would tackle really are going to be contingent on the existing research study you're building on and extending.
And are there any parameters around the types or rigor of research design that we're looking for? As a research program, we're looking for the strongest possible scientific rigor that can be marshaled in these, for these studies that give us generalizable evidence about the implementation and the impact of the system alignment mechanism that you're proposing to study. So that's what we're looking for. You need to think about the design, the analytics, the data, the metrics that best position you to produce evidence about implementation and impact in the context of the study that you're building upon, and in the context of the existing system alignment mechanism that you are continuing to study. And a study that otherwise meets this criteria has a rigorous research methodology, but they're still in the preliminary stages, but have not fully generated their data, or maybe haven't published that preliminary data yet. Would that proposal still qualify?
That's a good question. I would say the answer is possibly. I think you need to think about, as the researchers on that particular team, you need to think about what stage your research is in, and whether is it really mature enough to benefit from this limited supplemental funding at this stage, versus would it be better to wait, get further along in the original research study before you look at extending it with this. We do ask as part of the application process for you to provide, more information about the existing study that is underway now, its design and methodology, and to give us any, to submit up to 2 reports. These could be journal articles, or they could be preliminary findings, non-published manuscripts that describe more about what you've learned so far through the process. I would say for studies that are so early on that they actually haven't produced any, at least preliminary evidence about the implementation and impact of the system alignment strategy, it may be premature to target this funding opportunity. You might be better off seeing that original study further, closer to completion, having stronger, at least preliminary data, because you really want, you need that preliminary data to really inform the next steps for your study. That's ultimately that's a call you've got to make as as the investigator and as the research team here. Is your study far enough along to really to really understand the value of supplementing and extending it at this stage to understand how it functions in the context of COVID.
Awesome. And does ongoing evaluation of an existing ongoing direct service program count as an existing study?
Good question. This is one that we often get. Part of it is, is evaluation considered research for the purposes of this CFP? We actually have, some FAQs on that topic as well, so I encourage you to look at our FAQs. In general, I would say, evaluations that are designed to produce generalizable knowledge, evidence that can generalize beyond the study setting, the evaluation setting to other contexts. That would be an evaluation study. It would also qualify as research for the purposes of this CFP. So the answer would be yes. If you're building on ongoing evaluation work, and that evaluation work is designed such that it's producing generalizable knowledge, evidence that would apply reliably to other study settings beyond the settings being evaluated, then I would say yes, that could be a good fit. That type of existing study through an ongoing evaluation could very well be a good fit for this CFP.
And I've seen this question a few times, and would love for you to answer. Can a for-profit social impact company apply for this as a lead applicant if they are collaborating with a nonprofit entity?
Good question. For the purposes of this CFP, in terms of how the eligibility criteria are spelled out in the CFP, a for-profit entity would not be eligible to apply as the primary applicant. However, you could apply as a collaborator with a public governmental entity or a nonprofit entity, as long as that government or nonprofit entity would serve as the primary applicant. So it's a good question. For this particular CFP, it's limited. The primary applicant needs to be a government entity or a tax-exempt 501c3 nonprofit organization based in the U.S. Now, either one of those entities can have a partnership with a for-profit entity like a social impact firm organization, and that would be perfectly fine in terms of eligibility criteria.
Awesome. And does the preliminary research, can the preliminary research be investigator initiated, or must it be funded by NIH or foundation, for example?
Okay, well, I would say first, there's a lot of investigator-initiated research. In fact, most research funded through NIH and other federal agencies tends to be investigator-initiated. So I would say it's not an either-or situation there. For the purpose of this CFP, we are agnostic as to the type of research that is being used as the ongoing or recently completed research as the base that you're building upon here. It could be investigator initiated, or it could be initiated by the funding. The alternative to an investigator initiated study is a study that is initiated by the funding agency, whether it's a federal agency or a state agency or another, or a philanthropic organization. We're agnostic about the nature of that primary research that you're building upon. Could be investigator initiated, could be initiated by a funder, as long as it's producing relevant evidence about a defined system alignment mechanism that engages medical, social, and public health sectors in that work. That's going to fit for what the CFP is looking for.
And we've actually gotten a question that's a little meta, and that's specific. What is the logic for funding recently completed studies?
Yeah, so here we are trying to be nimble and to produce relatively rapid cycles, some evidence about how system alignment strategies work in this new world that we're living in the context of COVID-19. And so for that, to be able to produce evidence over a relatively rapid time horizon of 1 to 2 years, we're using this CFP to really target building on existing studies. The logic here is that if you have an existing study of an existing system alignment mechanism, you can adapt and extend those existing studies pretty quickly with a relatively limited amount of time and resources to produce evidence about how those system alignment mechanisms work in the context of COVID for populations disproportionately affected by COVID. That's the logic here. We're trying to be nimble, and we're trying to use a funding opportunity to produce evidence on a more rapid timescale by building on existing studies. Again, we recognize that there's also lots of new ideas for new studies that have come out in the context of COVID. We want to support those studies too. We think there's a lot of opportunity now for innovations and new thinking. That's the idea that you've got a new idea for how to align systems in the context of COVID. We encourage you to wait a little bit longer for our second CFP, which will be out later this fall, which will not have these same restrictions. These will be, our next CFP will be open in terms of new ideas for system alignment. It will also be provide grants for longer term and larger scale studies, more resources to support those studies. That's the logic for this CFP, is we're trying to be nimble, piggyback on some existing studies that can be extended in the context of COVID, hopefully produce some important evidence on a more rapid cycle basis.
Awesome. And we have a question. I think this will be a good opportunity to flesh out what we mean by systems alignment or systems change. So we have a question: can existing medical care projects with added components addressing public health and social services to our patients during COVID-19 qualify for the CFP?
Yeah, the short answer would be yes. So system alignment strategies that are being implemented, designed and implemented by a medical care organization could qualify here. We would just encourage you to make sure that that mechanism really has meaningful engagement of the two other sectors that are the focus of our action program. Medical care engaged with the public health and social services sector. What would not be in scope would be an alignment mechanism that's really narrowly focused in the medical care sector, primarily focused with organizing and coordinating medical care services, maybe with some tangential connections to public health and social services sectors. We're really looking for significant, meaningful engagement of all of organizations from all three of those sectors in the system alignment mechanism. If you've got that, even if it's an alignment mechanism that's kind of being led by the medical care sector, for this CFP, we would be open to that. We've done other CFPs where we've had more focus on things happening outside the medical care sector. For this CFP on supplemental awards in the context of COVID, an alignment mechanism that is being led inside the medical sector would be eligible here as long as it's got meaningful engagement with those other sectors.
And we have a question citing shared workforce and staffing models as an example of systems alignment mechanisms. And they'd like to know if applicants will be bound by the list of example mechanisms that we've included in the CFP and our research agenda as well.
We're always open to new ideas. And so certainly, yeah, you will see examples of mechanisms described in the CFP. You'll see a much broader array of mechanisms described in our research agenda. If you review our list of about 30 previously funded S4A studies, you'll see other examples of those mechanisms being studied. If you've got a new idea for us, we're always open for that. Again, as long as it is engaging all three of those sectors, and long as it's got a clear theory of change of how it's going to achieve alignment, how that alignment is going to translate into improved health and health equity, that's in scope.
Okay. All right, and we're getting a few quite a few questions about whether the Q&A will be posted after the webinar. Will any questions that we don't get into today, we will update questions for those to our Q&A page on our website. So you will have access to all questions will be answered and made available to you soon. So Glenn, how many more questions do you want to take?
I think we've got 4 minutes left, so let's take 1 or 2 more, and then we'll let it go.
And I'll ask this question. This is a good one. Is the school system considered a social sector organization? And I guess more broadly, just a little more clarification on what we mean by the various sectors, so social sector, public sector, and medical care.
Good question. The short answer is yes, absolutely. The way we define the social services sector, broadly defined, that includes the education sector, schools, early child care setting, early education, child education setting, schools, higher education as well. Again, encourage you to look at our definitions of those sectors in the CFP and also in the FAQs. You will see exactly how we're defining those 3 sectors for the purposes of the Systems for Action program. And we use pretty broad definitions, pretty broad inclusive.
Must the applicant be the primary org leading the existing study? Or can we be a lead in the CFP to partner with another entity which has the existing research underway?
Good question, and really that the latter is the case, that certainly if you're applying as the lead applicant for this CFP, but you are a collaborating applicant in the earlier study that you're building upon, totally fine. You don't need to be, if you're a lead applicant for the CFP, you don't need to have been the lead organization in the grant that supported the initial funding. We recognize, particularly for system alignment research, collaboration, multi-organizational strategies is the name of the game, and we recognize a lot of you all are partnering with other organizations to make these studies possible. So we're flexible on that front. But certainly, if you're the lead applicant, you should have been, engaged meaningfully in the original research that you're looking to build upon in some way.
All right, and I don't want to ask questions that will force you to repeat yourself. So if you have any final words for the last couple minutes, I guess we can go ahead and say those now.
Sure. I would just say thank you for your interest in the CFP participating today. I encourage you to take note of the our email address where you can submit additional questions, systemsforaction@ucdenver.edu. And again, our website, systemsforaction.org. A lot more information is available up on our website. And so please take advantage of that. And then feel free to email us with other questions that you may have as you're considering this opportunity and moving forward with it. And if this one is not the best fit, please remember we do have another more open CFP that will be released a bit later in the fall that will maybe be a better fit for those of you who have kind of new ideas for system alignment where you're not necessarily building on an existing study. So keep that in mind as well. Thank you so much for joining us. Feel free to browse our website. You can join us for our regularly scheduled research in progress webinars that happen every 2 weeks where you can hear from some of our existing funding, existing grantees. Other resources on the website that you may be of interest, to you in terms of the evidence that we're building from the studies that have been funded to date. Thank you so much. Thank you to our partners at the Robert Wood Johnson Foundation, and we look forward to hearing from you. Stay safe, everybody.